Today we will learn stomach points. There are 90 points of the stomach meridian, 45 on each side, 3 on the neck and shoulder, 15 on the anterior lateral side of the lower limb, the rest on the abdomen, chest, head, and face. The points of this meridian treat disorders of the eyes, ears, mouth, nose, teeth, throat, stomach, intestines, and disorders of the pathway of the meridian. The first point, stomach 1, 承气. It's an intersecting point of the foot Yangming, 任脉 and Yangqiao 脉. 承, Chinese means hold, and qi means tears. This point is located below the pupil, which means that it contains the tears. Location on the face between the eyeball and the infraorbital margin, directly inferior to the pupil. Indications: 1. Red and painful eyes, lacrimation upon exposure to wind, night blindness, blurred vision. 2. Twitching of the eyelids, deviated mouth and eye. Manipulation: 1. With the patient's eyes closed, push the eyeball slightly upward with the thumb and insert the needle slowly and perpendicularly, 0.5 to 0.8 cun along the infraorbital ridge. It is not advisable to lift, thrust, or twirl the needle. 2. Needle transversely, 0.5 to 0.8 cun toward the inner canthus. There may be local soreness and watery eyes. This point is very dangerous, so we should be very cautious. First, because there are many blood vessels around the point and it is easy to cause bleeding, the needle should be inserted slowly without lifting, thrusting, or twirling to prevent injuring the eyeball or causing hematoma. After withdrawing the needle, apply pressure on the side to prevent bleeding. The second, avoid inserting obliquely or too deeply. The third, moxibustion is forbidden. There's a case for this point. A 75-year-old man suffering from left eye, red, heat, painful, and swollen for over 10 days. Now he has tears and too much eye excrement, afraid of light and heat with blurred vision. What is the diagnosis? It's epidemic red eye, excessive heat. Treatment should be clear heat, cooling blood and eliminating toxins. Reducing method at stomach 1, prick the extra point, EX, head and neck 5, 太阳, and let bleeding. After 2 treatments, no red, heat, and swollen, no tear. The patient recovered after 4 treatments. The second point, stomach 2, 四白. The Chinese meaning 四 means the 4 directions, which indicates a wide area. 白 means white. Because this point can improve vision, enabling one to see in all directions, so it is called 四白. Location: on the face, in the infraorbital foramen. Indications: 1. Red and painful eyes, lacrimation upon exposure to wind, superficial visual obstruction, blurred vision. 2. Deviation to the mouth and eye, twitching of the eyelids, facial pain and itchiness. 3. Vertigo. Manipulation. This point is relatively safe than stomach 1, needle perpendicularly, 0.5 to 0.8 cun, or needle obliquely upward, 0.5 cun toward the infraorbital foramen. Numbness and electrical sensations can radiate to the upper lip. In China, children in school do eye exercise between classes. They press stomach 3 四白, bladder 1 Jingming, bladder 2 Cuanzhu, press extra point 太阳, and scrape around the orbit. This exercise can help relieve eye fatigue. Stomach 4 地仓. It's an intersecting point of the hand and foot Yangming meridians and Yangqiao Mai. Di means earth. Cang means granary. The ancients divided the face into 3 regions. Above the nose is the upper hall. The nose is the middle hall, and below the nose is the lower hall. These are also called the regions of heaven, of people, and of earth. This point is under the nose in the earthly region, near the mouth, where food enters the body. The stomach is associated with earth in 5-phase theory. The point may be named earth granary because it is located on the stomach meridian, earth, the granary organ, the organ that receives food. So the point is named Di Cang, the organ that receives food. Location: on the face, 0.4 cun lateral to the angle of the mouth. Location method: with the patient sitting upright or supine and with eyes looking straight ahead. The point is at the intersection of a vertical line from the pupil and a horizontal line from the angle of the mouth. Indications: toothache, deviation of the mouth and eye, swelling of the cheek, excessive salivation, facial pain, twitching of the facial muscles. Manipulation: needle perpendicularly 0.2 cun, or needle 1 to 2.5 cun toward stomach 6 夹车 to treat facial paralysis, or needle toward large intestine 20 yin xiang to treat facial pain. Stomach 5 大yin. Yin in Chinese means to receive or to welcome. The throbbing of the facial artery can be felt when palpating this point. This point welcomes all sensations, thus it is named 大yin. Its name might also be derived from its proximity to the lower jawbone, which is called 大隐骨, great reception bone. Location: on the face, anterior to the angle of the mandible, in the depression anterior to the masseter attachment, over the facial artery. Location method: with the patient sitting upright or supine with mouth closed and cheeks puffed, a groove appeared on the edge of the mandible. The point is where the facial artery pulsates. Rub the 大隐 point with the thumb for 3 to 5 minutes once a day. Can also be used for beauty. Stomach 6 夹车. The point gets its name from the mandible, which was formerly called 夹车 bone, the jawbone. Location: on the face, 1 finger breadth, middle finger, anterior superior to the angle of the mandible. Location method: the point is at the prominence of the masseter muscle when the teeth are clenched. When the teeth are relaxed, there is a depression at the spot when pressed. Indications: deviation of the mouth and eye, toothache, facial pain, twitching of the facial muscles, swelling of cheeks. Manipulation: needle perpendicularly 0.3 to half cun or transversely half to 0.8 cun. Local soreness can spread to the surrounding region. Or needle transversely 1 to 2 cun toward stomach 4 Di Cang to treat facial paralysis. Or we can needle obliquely half to 0.8 cun upward or downward to treat upper and lower toothache. Stomach 7, 下关. It's an intersecting point of the foot Yangming and foot Shaoyang meridians. 下 means lower. 关means joint or hinge. The point is located below the zygomatic arch, an area reminded the ancient Chinese of the door, bolt, 关. Thus, it is called 下关, below the joint. Location: on the face, in the depression between the midpoint of the inferior border of the zygomatic arch and the mandibular notch. Location method: the point is on the lower border of the zygomatic bone, slightly anterior to the condyloid process of the mandible. Locate with the patient's mouth closed. Indications: 1. Lower mandible pain, locked jaw, deviated mouth and eyes. Toothache, swelling of cheek, facial pain. 2. Deafness, tinnitus, ear infection. Manipulation: needle perpendicularly and slightly downward or obliquely toward the back, 1 to 1.5 cun. Treat temporomandibular disorders by triple needling. A 41-year-old woman suffering from severe toothache for 3 days. She had taken painkiller medicine while received no effect. Examination showed the upper molars suffered from root periosteitis with persistent pain accompanied by bad breath, thirsty, constipation, yellow coating tongue, large and rapid pulse. Diagnosis is Yangming stomach heat stagnation with ascending fire. Points chosen: large intestine 4, stomach 6, stomach 7, stomach 25, and stomach 44. Manipulation: use reducing method, rotation the needle for 20 minutes. And the pain stopped after 1 treatment. And 2 hours later, the stool passed out, dry faces like chestnuts. After received a second treatment, the patient feel no more pain and healed. Stomach 8, 头围. This point is the intersecting point of foot Yangming, foot Shaoyang, and Yangwei meridians. 头 means head, 围 means protect or the corner. It is located at the corner of the forehead and is therefore called 头围, head corner, or head protect. Location: on the head, 0.5 cun directly superior to the anterior hairline at the corner of the forehead, 4.5 cun lateral to the anterior median line. Indications: 1. Headache, vertigo. 2. Painful eyes, lacrimation upon exposure to wind. 3. Twitching of the eyelids. Manipulation: needle transversely, 0.5 to 0.8 cun backward. Local soreness can spread to the surrounding region.